on, Sparky. Good girl. You're a good girl, aren't you? The thinking on chronic pain has changed enormously from my days in medical school. In fact, if I go back to medical school, I can't even remember chronic pain being included in any of my lectures. It was not considered a condition in its own right. It was really just an add-on for other diseases. These days, I think we need to think about chronic pain as being a condition in its own right. We need to validate it. And as practitioners, we need to upskill so that we're able to deal with the enormous number of people out there who are suffering with chronic pain, who, as of 2012, are not getting the management that they really deserve. Traditionally, I think doctors are being quite confronted by the spectrum of chronic pain because they're so used to fixing problems. And it's often a challenge for doctors to change their way of thinking, to think, well, actually, this is a chronic condition. It's like diabetes. We're going to be in this for the long haul, but it's all about your quality of life and what we can do as a team to improve that. But if a patient goes into a doctor and a doctor just goes, oh, okay, well, I think we'll just work on fixing the problem with a drug, or this is a simple solution, or I can promise to cure you, a patient's often left a bit perplexed by that because often that's not the outcome in their experience. And so they think, well, actually the doctor didn't listen to me. They didn't understand where I was coming from. They just don't get it. Sparky, come here, come on. From the patient's point of view, they often feel as though they're not listened to, that they're not validated, that people doubt that they even have this condition. Hey, I can't see a lump or a bump or anything that's hanging off you that I can say, oh gee, I see that you're unwell. And so from a patient's point of view, it's often really important that they're validated. There's often an enormous amount of pressure on us as doctors to actually come up with a plan where the problem is eventually fixed and you're going to be able to sign off on that patient and that's the end of the story and the insurer doesn't have to worry about it anymore. Patients will often have conflicting sets of advice from a range of practitioners. Some of those may be doctors, physiotherapists, complementary therapists, and everyone might have a slightly different take on how to move forward. But with chronic pain, I think it's incredibly important to have a conversation between all the stakeholders and to really agree that we're moving in the same direction, because otherwise you get fragmented care. When the system's too fragmented, the patient is not going to have a great outcome because there are going to be too many conflicting points of view perhaps. So that's why a team approach where there's actually a conversation between the stakeholders is really important. And you know what, the central stakeholder is always going to be the person who's living with the chronic pain. There's one person I can think of who was a performer who injured their back. They had some back surgery, but most importantly, they engaged with the process of rehab themselves with Pilates and physical therapy and reconnecting with friends and getting out and about. And that was the turning point for them. They've moved from a period where it was a dark space where they felt that they were never going to reconnect with their life again to a place where their life is good again. They're able to move and participate in the activities that they enjoy and have a rich and meaningful life. They may still have some pain, but you know what? Life is okay. I think if you've got chronic pain, that having a GP who you trust and who knows you really well is an enormous asset. And fostering that kind of relationship with somebody who really cares about you makes an enormous difference. So as a GP, it's really satisfying to build that relationship with someone and work with them over the longer term to get them to a place where they feel as though they've got a better or improved quality of life.